snapping out of it. Dr. NIMA RAHMANY, thank you very much for joining me tonight. I want to do a little brief introduction to those that are listening to us real quick. So it was about a year ago that we started like doing the childish banter at one another about all this crap and blah blah blah, and I was still a whiny little snivelly little bitch, and you came into my life.
Oh, okay. Did you say? Sorry, I thought you said was. Did you say was? Okay.
Okay. And my background is that with the Men of Iron process and with what we do within the Freedom Formula is we help people to gain clarity on their direction as well as really define meaning. But then what we do is we help them with getting traction aligned with their meaning and creating freedom. And we give them the structures and the processes with which to do that. Now, in my process of building the frame behind how I coach my clients, I've had similar influences like John DeMartini, and I've done Warrior, and I worked with Ed Osborne, and we've done all this stuff. But I would say one of the single biggest impacts that's had not only in my ability to free myself from the incarcerated stories that I had that were holding me back from moving not only in this direction, but also just living in a place of an angry place of resentment. As you and I know, as we sat in your wife's car, as I screamed at the top of my lungs like a 3-year-old child. Yeah,
I'll never forget that day for the rest of my life.
NIMA was influential in basically assisting me with some of the processes that I like to work through in what I've shaped out in some of the tools that we use within the men and women environment. So that's my overall introduction. NIMA has been a significant impact, had a significant impact in my life and in my journey towards helping people the way that we now do within the Men and Women of Iron. So first of all, gratitude, thank you. But I think that because I reference you so much, NIMA, I would love to have this as a specific conversation, really just even if it's short, to go back into your background. Like,
sure.
Because you and I both have been our kind of sort of chiropractic is our background, but there is a bit of a twist and a bit of a history as to why you, like myself, have started to move into the evolution of life transformation work. Can you just start into it?
I mean, it's interesting because I still have my chiropractic license. I still work one afternoon a week in Vancouver. I just can't seem to get myself out because I love it. And yet while I'm here, I can't avoid the conversation. Literally an hour ago, a patient just walked in and she's like, okay, this is a new patient. The usual back symptoms, shoulder symptoms. But she said, yeah, I'm a cancer survivor. I was diagnosed with cancer 2 years ago, and she looks so healthy. I mean, she's in her 50s and she looked amazing. It was like, you do not look like a cancer patient. She exercises. She goes, I exercise, everything was good, and then I got colon cancer. And then naturally, the questions that I cannot help but ask start to come out. It's, in other words, I'm here in a chiropractic clinic, but I can't help but ask this question. And I asked her, I said, so around the time of your diagnosis, what conflict was going on in your life that was really difficult, that was unbearable for you around that 6 months to a year of that time? And then she's like, oh, interesting. Nobody, in all of everything I've done, she's done the naturopathic, whatever, nobody really ever asked me that. And I said, that's what it is, which led us to a conversation in which she just enrolled for my breathwork and inner child workshop this weekend. And the reason why I do this now is because any chiropractor who's been in practice more than 10 years can't ignore the fact that there's a stress-related emotional component, life conflict unraveling fuckery component to what got them physically stressed. And while it's great to do adjustments on people and to have them get up and go, wow, Dr. NIMA, Dr. Ryan feels so great, there's an egotistical part of me that says, that gets really upset when I wasn't able to reach all of the people. No matter what you do, you can't get them all. And I wanted to go deeper. My ego wanted to go deeper. And that deeper layer was, at first I thought it was the stories that we tell about our lives. And then what I realized is it's not just the stories we tell. The stories we tell are only there because of the stories, our bodies, of the lack of safety that's in our body that creates a story about our environment. So it's like experience, trauma, lack of safety, interpretation and story, and life. And now we start repeating these patterns and we start replaying these experiences in our lives that match the story that's happening in our body. So my first when I first started becoming aware of this, I developed a methodology integrated from John's work and Byron Katie and all of the amazing, Joe Dispenza and all of the amazing impactful instructors that we've all read books on, attended their seminars. Like, I don't know most of the chiropractors and stuff that I hang out with and talk to, they've done the breakthrough experience. They've experienced, the stack, we cognitively have be able to do that. I knew that there was a feeling-based component to it that was missing. And I, looking at the breakdowns in my life, usually in the realm of relationship is a good mirror for how your nervous system is. Your partner will bring up all your unresolved stuff to hold a mirror to let you know everything that is unresolved in your attachment wounds. And I realized that my unresolved attachment wounds were having me repeat patterns and cycles in relationships.
Okay, so that's the part of me just for a second. I got to interject because I know exactly where you're going with this, because you were searching for there was solutions. All of us, I want you to consider, like, for me, it's been 10 years from when I said to Tracy, I don't feel anything. I didn't feel pain. I didn't feel excitement. And that was my journey. I had my own background stories. I had my family issues, all kinds of different things. But for you would also, this wasn't like it just, you came out of nowhere and you bought a Porsche and it was like, but this was a slow process of understanding. You were searching for years, working with John, going through extensive training in order to become the best at what you're doing at these things. But I think for you, if I, like most of us, there was a point where you're like, fuck it, this is it. Like, I think for you, it's like you're hanging on to chiro because you see the link between the nervous system and everything else. But for you, like me, there's so much more. Are you able to identify the point where you were 100%. Like, I have to do this?
Yes. Yeah. It was after I got divorced and I realized that, okay, what makes my heart sing is teaching. I just love teaching. So I started with doing a life skills for a stressful world workshop in my clinic in Maple Ridge, BC. And I just love teaching those things. And what I unknowingly was doing this entire time was integrating a methodology to heal my attachment wounds. Essentially, I was giving, and I hate to use the word medicine, but in a loose term, I was giving the remedy that I needed myself to heal my attachment wounds with my primary caregivers, which pretty much forms the neurological basis for every relationship in our lives. I realized that the culprit wasn't the people that I was dating or married to. The culprit was my nervous system. And by working towards regulating and healing those attachment wounds, I knew every patient coming in to see me, oh my God, this is an attachment trauma. Okay, attachment trauma. diagnosis attached, like the root cause of the root cause. That moment where I was like, I can no longer just deal with the surface area stuff. I have to deal with the attachment wound.
That's it. And again, just for a second, so it can speak to the lay population who's going, what the fuck is Dr. NIMA talking about? We're talking about when we get triggered and angry, or we have these built-up resentments, or whatever kind of trigger comes up, we will literally trigger it to the person that's right in front of us that we feel has done something to us or at us, or it's coming at us. But what we actually start to recognize is that the trigger is bringing us back to a place in our life where it's occurred before, and all we're doing is we're bringing it out and putting it right in front of us. And that person literally becomes the shooting target for our unresolved bullshit. Am I saying that in lay terms well enough?
Yeah, you're saying it perfectly. Essentially, what I realized that the greatest skill, like I went through hell and back in my relationship, one toxic relationship after another, until I realized that the greatest skill that I can develop that I had no fucking clue how to do was how to take a trigger in a relationship or at work. You know, I was constantly at the effect of my nervous system being triggered by other people when things wouldn't go my way. I realized that what it was in front of me wasn't about what it's about. It's about an unresolved wound. Where there's a reactivity, there's a wound. And that wound comes from, it's deeply embedded in my nervous system long before I had language or cognition. So I was using DeMartini, the work, the stack, which are all cognitive-based tools to work through triggers, whereas I wanted to learn how to regulate it in the moment, to expand that space between stimulus and response. Because if we don't learn how to take that stimulus and expand that space between reaction and turn it into a inspiring response, no relationship can work. Parenting is crap, and you pass your traumas that you receive from your parents down to the kids. And you don't have an ability to design your life. In other words, you are run by those unconscious complexes that are triggering you. You don't have the ability to create your life, because that space is where your life is created, where your reality is created.
In the emotional and in the trauma. The trauma is actually perpetually moving forwards, and you're recreating it and bringing it up. And
it's driving the bus.
Yeah.
It's driving the bus. And without the proper training, the practice, what happens is a couple will trigger one another's old childhood woundings and react, and then wound upon wound, and then over a period of time you have complete dissociation and you don't have connection, and the anger you feel towards your mother gets projected onto your wife or your partner, and you play the victim to them. And one of the things that I stand for now, what I realize is, if we don't get this right, we pass it on to the kids, and then intergenerational trauma just keeps passing down. Health issues happen, and the fabric of society, which is the family, breaks down. And so I realized this is a health crisis. It's an economic crisis. It is a mental health crisis. And just by paying attention to going inside and turning my triggers into deeper self-love and conflict into deeper connection, we can transform family dynamics. Couples who haven't slept together in 7 months start to heal and get connected. I mean, you know.
Well, and that's going to bring up my next question, because there's one of the easiest to understand from like an omniscient kind of point of view is, we can see people that have experienced severely traumatic situations, and then we tag it and label it PTSD, post-traumatic stress disorder. Well, when that trauma is strong enough, it sits deep enough within one's subconscious level, that anything that comes up that even comes close to eliciting a similar response, the response of the individual will come out exactly the same way as that trauma will come out.
As if it was happening now.
Yeah, like it's happening now. And to everyone around them, they will look at them, and the words out of everybody's mouth is that bitch is crazy. Meanwhile, inside of you, you cannot
No willpower
regulate the
changes.
emotion because it is to you
It's real.
happening. It is real, and
Yeah.
that's one of the most I'd say easy to understand. But you watch this play out in relationships where the wife gets triggered by certain activities or words, expressions, mannerisms. Doesn't matter what it is.
Just a look.
Yeah.
Just a look. If you have, like, okay, so for me, if you say my name with just a little bit of a raised voice,
NIMA.
immediately, or if you go, NEEMA, all of a sudden, my body's going to go like this. Okay.
Sphincter
So,
pucker.
exactly. So what that means is my subconscious has an association to that. So here's the thing. If we don't resolve that and we don't learn the tools of regulating that, we literally carry it with us to the next relationship. And they're carrying theirs with them to out the relationship. And so you have two people who, when you get triggered, you have complete inability to have connection. You don't have an ability to create intimacy. And now we have families falling apart, and we have mothers, we have children not feeling emotionally attuned, and health crises happen. And then here's what happens. Then you get to a place where you're like, I don't know what my purpose is.
Right.
I don't really know what my purpose is.
Which brings me back to me for a second. So
yeah.
this is why I love this conversation, Doc, and thank you. So I want to bring up the topic of who it is that we help. So for me, I came into my world. I got lost with my purpose, couldn't figure out my values or what to stand on. And then the world was happening around me. I was triggered by family, triggered by work. I was angry. I was miserable. And because I wasn't able to get any clarity, then what happened was I went down this road and got so far down the rabbit hole that I couldn't figure out how to dig myself out of the shithole. And that's why, for me, like being a business owner, helping people the way that I did, this is good. Should it not, like the should story, should this not be enough? But inside of me, there was no light, there was no passion, no purpose, because I hadn't figured it out. I had to hit my shit pit in order to establish that, which is why I typically work with business owners that are looking for basically that direction, that clarity, finding the meaning, the passion. But while I'm doing that, while they're working to create that clarity, the meaning, and being able to grow their businesses and their families all at the same time, the tricky part for me that I realized was that I couldn't just teach them cognitive tools. I had to reach into the toolkit because all these old stories kept coming up. So it has to be, this type of work has to be part of the process that I work through with most of my clients. So that being said, I work mainly with like people who are in business, entrepreneurial. That's and they've got families that are going on. Who is it that you like? I know like who you love to work with. I know that, but who are you finding is finding this work that you do, NIMA? Like I know that this is morphing a little bit. The window is shifting a little bit. It's doing this a little bit. Who do you love to help? I don't know if this is a fair question. Who do you love to help? But who's finding you? Who needs this right now?
What's happening is people who are finding themselves in a space where relationships aren't working. They're not able to create a secure relationships with their partners and with their work, essentially. Essentially anybody who feels like, here it is, enmeshment and codependency is a big word. Let me explain what those are. This is what I realize who's been finding me and who I've become. I think I've been merging towards this. This seems to be, I found the holy grail for this. Codependency is when you hide your truth to someone because of fear of rejection. Okay? Okay? Codependency means I'm going to suppress my truth to you because if I tell you the truth, tell you the truth of who I am, you're going to withdraw your love and I'm going to be alone. Now, codependency can happen in romantic relationships, it can happen with your children, and it can happen with clients. So 2 years ago, I was in a space where it was my last breakup, and I was like, all right, I now see what the problem is. It's me, and I don't care whatever distance I have to travel, whatever price I have to pay, I got to figure this out. So I set on the path of creating a secure attached relationship, which means there's an ease of flow between hanging out and separating. There's not this anxiety in the relationship, this codependency where there's a distancer, give me some space, or there's a pursuer chasing after. This whole push-pull dynamic, which is really a trauma bond. I was going from one trauma bond to another, codependent trauma bond, where you have one person playing the role of a narcissist, the other person as the codependent, and sometimes they switch roles. They're mirrors of one another, so one is one, one's the other, and they can switch. And I needed to heal that.
I think the easiest way that I describe it, Nima, just to simplify it, is one person gets needy of the other.
Yes. So it's anxious attachment, avoidant attachment. These are insecure attachment. Yeah. And bringing that, I said I needed to bring I was the avoidant. I was always attracting needy, anxious attached. My vision is I want to do whatever it takes to become securely attached so that I can attract a secure attached partner. And I'm not going to coach anyone. I'm not going to help anyone. I'm not going to distract myself with work and sedate myself with work and being irrelevant and important. I'm just going to stop all of that and work on me. And once I've gotten that holy grail, which is a secure attached relationship, then I want to teach others how to have the same thing. Well, just so happens that I got it and I'm in that situation where I have it. And then I realized I have codependency with clients. And I'm like, oh, crap. Now I'm finding myself needy with clients. And when you're needy with clients, you can't really tell them the truth because you're going to withhold the truth because you don't want them to leave. Yep. But if you don't have a fear of their loss, you can take off the mask and just be truthful and get them better results when you're not as needy. So my next frontier was to create within me a space inside of me to heal the wounds that had me show up as needy in business. And this is our work in progress. This is all of our work in progress. This is why I started focusing on that and started teaching that, was because I believe that the codependency and then the enmeshment, which is the lack of boundaries of emotions, that the other person is in front of you is emotional, and then you take on their emotions and your fear of their upset, and you don't have a boundary between what's theirs and what's yours, whether you're in business or in personal relationship, is the main culprit in every single breakdown in personal and business, is enmeshment and codependency. And I found the solution for me because I didn't want to be at the effect of others. I didn't want to be run by my clients. I didn't want to be run by a partner. I wanted to be self-inner guided. And so that is, I help people who are stuck in those two dynamics specifically. That's the holy grail as far as I'm concerned, is healing from enmeshment and codependency.
You gained a tremendous amount of clarity on that, because the number of people that I've seen you help with the work is like, you could cast a vast net, but I see that you've really, really kind of narrowed into those. Yeah. And I hate to say it, because most of us currently suffer from those two things. It's just that we don't even know what the hell we've gotten ourselves into.
Totally. Let me give you
essentially, we label it something different. We label it, I'm just a people pleaser, I need to make everybody happy, as opposed to I'm the codependent.
Right. Or my mother is toxic, so I can't talk to her. Yeah. When in fact, here's the truth, is when my mother has emotions, I can't keep myself in, so I need to keep her out. Yeah. So essentially, people are living with enmeshment trauma and codependency, and they don't even know it. It's just manifesting in chronic health issues. It's manifesting in toxic push-pull dynamics. And when you keep going, you want to mind fuck here? When you keep going upstream, you want to know what it is? Shame and guilt. If
Yep.
you just keep going upstream, if I did something or I didn't do something or I neglected to do something that I should have, in my opinion, and now as a young boy or girl, I am now a bad person because of it. Deep down inside, my sense of self-worth is shit. I'm a piece of shit. I'm a bad person. So I'm going to go to great lengths in my life, in my business, to show up bigger than I am, to be very, grandiose, to please others, unconsciously trying to please and make others happy because there's a little piece of shit part of me that I haven't gotten complete with, which is the root cause of the codependency and enmeshment. When I realized that, it was like, okay, I think I found the Holy Grail. And it's literally, I keep going upstream. If I could just keep going upstream, there's a younger part of me that I feel ashamed of and I don't want exposed and I don't want
Well,
you to
and
see.
I think that it kind of ties back into I think the way that I've cognitively bypassed this, if we want to use Russell Kennedy's
Russ,
word,
yeah,
is, right? So if we want to use that, is that I think we all have it. Doesn't matter what your religious background or what your belief system is. I think we all have a very difficult time with object permanence. And when we have certain things that are in our life, we fear their removal, right? We have a difficult time stepping into the feeling of loss. So the thing that we fear losing the most becomes the object that controls us the most, whether it's inanimate or living, right?
and
And
we
so
don't even know it's there.
you don't even know it. And if we got to a place where we just recognize that we will eventually lose our right arm, we will eventually lose the function of our bowel, we will eventually lose mom or dad
We'll lose it
or
all.
ourselves first.
Everything is temporary.
But this is all the whole rational part of this existence. We don't want to have to deal with those losses. We want to hold on for dear life, so we'll do anything that we can to
Go
stay
to great
completely in
lengths.
that.
Yeah.
And it's all that's
And,
how I kind of
and what you're
explain.
talking about right now, essentially, Ryan, is a spiritual path, is a spiritual journey to heal the business, family, body, being, business, whatever that Garrett talks about. This is this is our spiritual evolution. It's going from victims of our lives to manifester. I'm going to get there and do it. And then you burn yourself out. And then you start to develop even further. This is what I'm working on, developing from the manifester to the channeler, which is like, instead of it happened to me, and next level is it's going to happen by me. I'm going to manifest it, which is like the push, 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 and then you burn yourself out. The next level that I had been working on, which is of my spiritual development over the last couple of years, which was the channeler. It's happening through me. So I do transmissions, I do live events, and I insist that I do not script anything because I want it to come through me because I'm the channeler. The next phase that I'm working on over the next 6 months to the rest of my life is the it's happening as me. Like I am life. I am the universe. It is like I am a co-creator of my existence, health, business, whatever. And I've been able to do it. Like my relationship
Well,
is
and
extremely nourishing. I have a family and I never thought that this guy never committed.
yeah,
This guy
no,
was
I
going to be
never
a
thought you
player
would
for
either,
life.
buddy.
And now I'm a dad and I love it. And my facilitator program is coming. My book is coming out
So
within the next few
let's talk
months.
about this. Let's talk about this for a sec. So
Yeah.
that's where I want to go before we end, because I too have to actually run. But here's the thing. Within my program, what I've learned, because we run our programs like largely based on like how we help ourselves and how we've helped ourselves get out of our things. For me, what I've learned, NIMA, and one of the things that you really re-instilled in me is that a large part of this work, some of it's as simple as just focusing on your breath and doing the breath work. Some of it for me, I do have to get into the stories that I'm not bringing out and spewing onto a piece of paper, so that I can examine where are my emotions coming from, and then I can examine them so I can choose a direction that's more in alignment with myself. I've learned from you as well that I have to do this work daily. And so what I teach is I can choose to do this work daily because I want to be the creator and in control, or I can say, fuck it today. I do that. I'll do that sometimes with exercise. I'll do that with my dates. I'll do that with different pieces. But then the brain starts to learn I can do it again, and it becomes a different mindset, which I call the fuck it mindset. Like, it's either I'm doing this and I'm co-creating this life that I'm moving forwards, or I'm going to allow it to come at me and I'm going to go into this. And both of those are choices. But that's been one of the most important pieces that I've instilled in my clients, is the work that is done doesn't have to be super complex, but it's more powerful. I want people to consider that it's more powerful when it's done consistently in bite-sized chunks. That being said, you have a couple of things that are coming up, and people, I can't encourage people to dive into your work enough. How are people, how do people get into your work? What does it look like?
Well,
I know you got a couple things coming up, so I want to lead into that.
Yeah. My Facebook group is the first thing right away. I also have a training on becoming trigger proof, like the steps that you go through. You went through it. Your wife went through it. Like tons of people we know, like it's growing really fast. And I have a training that teaches. It's 90-minute training. I'll send you the link right here. And becoming
what's the Facebook group so people can look it up?
Trigger proof.
It's called Trigger Proof.
Yeah. So this here, I'm giving you the link for the virtual workshop, the 90-minute one. It's right there. Now, I have an event coming up this weekend called Breathwork and Badassery, where we go into the stuff that you've learned, the inner child work. We're going to be dealing with shame this weekend. We're going to be going into dark passenger shadow work. And
Which
then
it means nothing to those people who are listening to us. I want to make sure that I'm trying to bridge the gap between that. It's the inner little bitch that doesn't shut up.
Yes, and the part that you're not even aware of, that you're trying to hide, the part that's ashamed, that's jealous, that doesn't feel worthy, that part of you is your shadow, is your dark passenger. And without really acknowledging it and working with it, it will run the show. So over the weekend, you're going to, the breathwork and badassery is a exploration and meeting and dancing with and reconnecting with that dark passenger that we all have, that if we don't connect with, will run the show. So it's a choice of, I will choose to be the one in control or have it control me. So that's coming up, and then the overview experience the following weekend. I think the links are there.
Sure.
Yeah, if you have any questions, I'm happy to answer them. But essentially, that's a great place to start. You come in with an open mind. What we do is I lead you into a meditation, and then you're going to have an hour where I'm going to teach you how to consciously connect to breath. And you start realizing two things. Number one, you have an ability to regulate your nervous system. And number two, how little you're breathing day to day. And you'll be able to have a tool that is free of charge, that you'll be able to access in every moment, that helps you get out of your head and get into your body and bring your level, your heart rate variability, all of that down, so that you now are able to be the one in control rather than have others control you.
Awesome, Doc. Well, listen, I've got all your links. They're going to be posted along with this, both in the podcast as well as onto YouTube. I'm going to send this off to you. I hope everybody gets an opportunity. Anybody that listens to this, I highly recommend that you take Dr. NIMA up on this work. It is, there's just more behind it than what we can really say in a half an hour of just shooting stuff. And more than anything else, I think, NIMA, I would like to continue the conversation like the 3-year-olds that we were when we came into this.
13.
I would like to get like Neanderthal and completely juvenile with you right now, because I think that's an important part of that little inner little bastard that likes to come out every once in a while. But listen, first of all, I'm super grateful. Thank you, my friend.
I'm really proud of what you become in a year, bro. I gotta tell you, I want to acknowledge you and Tracy. It's been amazing working with the two of you and seeing your relationship flourish and you guys, and you turn into the leader that you've become. And it's an honor to witness you and to be a part of it.
Doc, thank you, my friend.
Big
Bye
love.
for now. I'll be
Bye-bye.
talking to you soon.
Bye-bye.
Thank you.